Good evening, buddy. What's up? It's me, the Wingman. Yeah, it's me, the Wingman, Kadero Hudson. I'm here to deliver that sauce. Yes, it's been a while. It's been a while. The last video, I'm talking about the tech stocks for you to buy, for you to be able to have $1 million so you can be rich out here. Let's talk about it. But we're not going to talk about tech stocks today. We're going to talk about healthcare. We're going to talk about big pharma, big money. Yes, we already know big pharma, healthcare, hospitals are going to be around. But before we start, just know, you know how it is. I am Kadero Hudson. I deliver that fire, saucy content. I talk about how to make money in the stock market, financial planning, money management, financial planning, uh, financial management, and then also how to not only just make money through stocks, crypto, but also affiliate marketing. I'm just a one-top shop, Swiss Army knife to be able to make money in this market. And so, if you're ready to learn how to make money, we're gonna dive in. We're not gonna waste any time. So, big pharma, we're gonna talk about how can you make money with medicine, hospitals, and big pharma. We're going to talk about the comparison between United Healthcare, Cigna, Cigna Health, CI, and also Elevance, which is also called Anthem, which is also known as called Blue Cross, Blue Cross Blue Shield. So if you work in every day, like I am, every day I work in operations. In operations, when I do new hires, we sit down and we come into corporate, and when you talk about your benefits is always going to be broken down into uh, United Healthcare, Cigna, or Blue Cross Blue Shield, or change the name to Elevance. And so, with these three players into the healthcare provider space, it's basically a monopoly. It's hard when you sit down as a company, as HR, to negotiate the prices of healthcare. It's really usually going to fall between these three big name players. And if United Healthcare decides to want to increase their health insurance by 25-30%, and you're negotiating, and they decide to stiff on you, then sometimes you got to take your working population and move it to probably Cigna or Blue Cross. Depends on who's delivering or giving you the best deal, right? And so this needs no introduction. So usually uh, when you have insurance, like right now, I have United Healthcare, and also I have United Healthcare not only just in real life, but I also have United Healthcare in my dividend growth portfolio. But why do I have it? Is it the best bet, or is it better than Cigna? We're gonna see. So United Healthcare costs $491.31, right? So we're gonna go year to date. Year to date, it is down 7%. Now you may be alarmed because the S&P 500 is up roughly 10 to 11% right now. Is up upwards of 20-25%. Some like Nvidia and other companies have been up more than 30%. So yes, you may look at this and be alarmed, like wow, a lot of stocks that have been lifting up the S&P 500. The Nasdaq is up, and United Healthcare is down. Right, it's down 7%. It costs $491. Kadero, why do you have this stock in our face? Right, I feel you. I feel you. I feel you. But all these videos is to talk about stocks that you can hold for the long run that's going to 10 back your investment for you to retire with virtually with $1 million. And United Healthcare is one of those stocks that if you hold for the long haul, the long run, 15, 20, 25 years, these are one of those stocks where it doesn't pay a high dividend, but the low yield mixed with the high dividend increases, mixed with them buying back their stocks, share buyback, uh, and then also, I'm sorry, I didn't mean to touch the microphone, but also, United Healthcare is the number one player in the healthcare provider space, right? So it's the number one big name player in health services, uh, the healthcare provider service space. But a stock that has been doing really well, that's I would say that it's a competitor to Blue Cross Blue Shield and United Healthcare is Cigna. Cigna Healthcare, CI. And in lately, in the past 5 to 8 years, uh, so over the past 5 to 8 years, United Healthcare and Blue Cross Blue Shield has only really been like the big name players, and Cigna has always been like their little brother, right? But over the past 5 to 8 years, now I can contest to it because I've actually looked at a lot of the different medical uh, plans and just how much it costs. Cigna, I guess because they've been buying out little pharmacies and different pharmaceutical companies, and they've really been able to diversify their rates and their plans to best suit the workforce. And so Cigna has really shown to now being able to try to be able to compete against the giant head of United Healthcare. So the Cigna Group has a target stock price stock symbol, a ticker symbol of CI. It costs $272.25. So Cigna's stock price is $272.25, and uh, so right off the bat, it's a lot cheaper than United Healthcare. And I wonder, yes. So United Healthcare is the big name player, and so that's down 7%. Here, Cigna, I would say, since it's United Healthcare's big brother, little brother, is right now is down 19%. But since it's down 19%, it proves it as on a discount for you be able to buy in now at a low price, so that you can make a lot of money in the next 15 or 20 years. And so in the last 5 years, so it says that it's been compounding last 5 years of 49.31%. And so it went from, it was on only paying like on an annual basis, and then now recently it begins that now it pays on a more quarterly basis. And basically, Cigna Group is CI has really been shown to now pick up steam, making a lot more money, and try to rival its competitor of United Healthcare. Lastly, Blue Cross Blue Shield. I don't understand why my screen is on the left side. That is weird. It should have been on the right side, but whatever. What? I'm back on the bottom. That's great. So Elevance, which is Anthem, which also is called Blue Cross Blue Shield, is the direct competitor of United Healthcare. It costs $468.63. It is also, I'm pretty sure, the healthcare provider space got to be down this year. I wouldn't be surprised by me looking year to date; it would be down. Yep. So uh, since Elevance, which is the Blue Cross Blue Shield, is the direct competitor of United Healthcare, they're both down roughly the same 7%. Cigna, since it's more of a small cap stock, when when it does bad, it's going to do even worse than the other two because it's a smaller cap. But when they're doing well, it's going to do a lot better than Elevance and United Healthcare because it's a smaller stock, smaller in the space. But then as they begin to pick up more contracts, pick up more steam from its competitors, winning out bids of Anthem and United Healthcare, they begin to make more money, right? And then with this, with these healthcare companies that will compound your money at a 20 to 25%. If you were to choose one, I would say like United Healthcare or like Cigna, right? If you were to choose one and you start out with $100 and your person was to invest like $500 per month, they would be able to make $1 million within 15 years because Anthem, United Healthcare, Blue Cross Blue Shield, it's not going anywhere. When you go to the doctor, you're gonna use one of the three. So when you go and use your healthcare card, you either gonna either have United Healthcare, Blue Cross Blue Shield, or Cigna. So out the gate, the threat of any of them going away, it's extremely low. And I would say the only reason I would be scared for it to go away is if maybe one of the big name players of United Healthcare or Blue Cross was to buy out Cigna, then okay. But then if that was the case, you'll get shares of that company that if it bought it out, right? That's one. And then two, there's going to be always going to be a elderly population that's going to need healthcare, that's going to need medicine, pills. It's going to need all of that, and so healthcare is never going to go away. Healthcare is always moving, always making money. They make money, or like just like the Apple with the service or subscription based model with the United Healthcare and Blue Cross. They make a lot of money on like the tech side. They make a lot of money on people with hospital plans. Uh, so you can see that out of one of these, if you were to invest on a monthly basis, you will get a rate of return of at least 20-25%. On top of you compounding and you spending 250, in this example, a person spending $500 per month. Now, I know a lot of people can't do $500 per month, but if a person were to invest $500 into United Healthcare, the money that they will be able to see within 15 to 16 years it would be a diverse portfolio, but they would just have a portfolio of just United Healthcare. And they would also be a lot comfortable knowing that United Healthcare is going to be something that everyone is going to need, that needs it now, that's going to need, that's using it now, and in the future will continue to need because people are going to continue to need healthcare, health plans, hospitals, etc. And so I wanted to go over 3 examples of healthcare providers, the difference between United Healthcare stock price, the annual returns as of right now in the last 5 years. And so there's a reason to compare and contrast United Healthcare with Cigna versus Blue Cross Blue Shield, but also showing how these stocks, if you stay consistent, you staying in the market, time in the market beats time in the market, staying consistent and choosing the right stocks to give you that 10 bagger, you stay consistent, you can make money and have $1 million of stocks. Most importantly, $1 million in net worth. So hopefully you guys enjoy this video. Enjoy the reason why I get so excited into especially a lot of these low yielding stocks like Apple, Lamb Research, KLAC, United Healthcare. These stocks have a dividend yield less than 2%, but they increase their dividend 15-60%. They do share buybacks, and then the rate of returns like 25%. Man, imagine you starting out with $10,000 and you investing $250, $500 per month, and then you get receiving the dividend, and you letting the dividend reinvest in itself. Ooh, hey, baby, my goodness. Whew, I'm just getting excited, baby. Like the juicy dividend increases, your money doubling every 3.5 years. My goodness. Whew, man. Hopefully you guys enjoyed this video. Hopefully you probably add United Healthcare or Cigna into one of your dividend growth portfolios. If not, hey, you don't have to. But hey, make sure you do some research. Most importantly, into like Tesla and into Apple, and hopefully you have one of those bad boys in your investment portfolio because those bad boys are gonna take me to the moon. All right, I'm out, baby.